Hey Nurse Fam, welcome to Case Point. Nursing school and clinicals can feel like an emotional roller coaster. Exams, patient care, staff dynamics, oh my. Today I'm sharing a psychological survival kit to help you stay grounded, focused, and compassionate using the ADPI framework. Assessment. Understand the stressors. Stress journal. Track triggers. First, assess your stressors. Keep a small notebook or digital note to jot down moments when you feel overwhelmed, drained, or conflicted. Note the trigger, such as a demanding patient, a critical staff member, or exam pressure, and your emotional response. Why it works. Pinpointing stressors helps you recognize patterns and prepare targeted coping strategies. Diagnose. Identify emotional and professional needs. Then, diagnose your needs. Try self-compassion mantras. Memorize phrases like, I'm doing my best, and that's enough for now. Or, mistakes are part of learning. I'm growing every day. These remind you that you're human, not a robot, even when the pressure's on. Why it works. These mantras counter self-criticism, which is common when juggling school, clinicals, and patient care. They reinforce your humanity and resilience. Planning. Create a toolkit for resilience. Tool 1. Boundary affirmations. Practice scripts like, I'll get back to you after my shift. I'm not available right now. Or, I need a moment to process this. These protect your mental energy without guilt. Why it works. Clear boundaries prevent burnout by preserving your time and emotional capacity. Tool 2. Stress hacks. Box breathing. Inhale for 4 seconds. Hold for 4. Exhale for 4. Hold for 4. Use during a chaotic shift or before an exam. Grounding technique. Name 5 things you see, 4 you can touch, 3 you hear, 2 you smell, and 1 you taste to anchor yourself in high-stress moments. Why it works. These quick techniques regulate your nervous system, helping you stay calm and focused. Tool 3. Emotional intelligence tips. Active listening. When dealing with staff or patients, paraphrase their concerns. E.g., it sounds like you're feeling frustrated because. This builds trust and de-escalates tension. Pause and reflect. Before responding in a conflict, take a breath and ask yourself, what's the most constructive way to handle this? Why it works. These skills improve communication and help you navigate interpersonal challenges with empathy and professionalism. Implementation. Put tools into action. Scenario. Conflict with a staff member during a clinical shift. You're a nursing student on a busy med-surg floor. A senior nurse snaps at you for not completing a task quickly enough, leaving you feeling inadequate and overwhelmed during a hectic shift. Application, boundary affirmation. Politely say, I hear your feedback and I'll address it after I finish this patient's chart. This sets a boundary while staying professional. Stress hack. Step into the break room for 30 seconds of box breathing to calm your nerves. Self-compassion mantra. Silently repeat, I'm learning, and it's okay to take time to get this right. Emotional intelligence later. Approach the nurse and say, I want to improve. Can we discuss how I can prioritize tasks better next time? This shows humility and de-escalates tension. Outcome. You maintain your composure, protect your energy, and turn a stressful moment into a learning opportunity. Evaluation. Reflect and adjust. Weekly reflection check-in. At the end of each week, review your stress journal. Ask, did my boundary affirmations work? Were my stress hacks effective? Did I stay compassionate with patients and staff? Adjust your approach as needed. Maybe you need a new mantra or a different boundary script for a recurring issue. Why it works. Reflection helps you refine your toolkit, ensuring it evolves with your challenges. That's your psych survival kit, nurses. Use ADPI to stay grounded and keep your heart in the game. If you found this helpful, hit that subscribe button, like, share, and drop a comment with your go-to stress hack. I'll see you next time on Case Point. Stay strong and compassionate.